Roy, consultant neurologist, Apollo Clinical Hospital, Calcutta.
Thank you, ma'am. Respected chairpersons, and good afternoon to everybody. Now we are in the second session post lunch, and I want to be really brief because a lot of other good speakers are there. Just give you a little overview of the fact sheet that the incidence of cerebral palsy, as shown by Professor Apurva Ghosh, it's around 2 to 2 per thousand live births, and globally there are about 17 million CP patients. And US, there is an estimate of about 7.5, it's 764,000 in children and adult CP patients. And in India, this estimate is about 2.5 million. So this is the quantum of the problem. And the CP incidence and prevalence is not also low in this part of the country. A study has been done from Kolkata itself, which was pioneered by Professor Shamal Das from Bangalore Institute. I was associated with that, and that was published in the Indian Journal of Pediatrics in 2009. It showed that the prevalence rate of 282 per 100,000 live births in Calcutta, and among them, 31% the CP patients have epilepsy. Now, the task I have been assigned to talk about the problems or the risk associated with the treatment of CP patients. Now, the risk factors in a patient with CP is basically many folds, as already shown by the earlier speakers, but the most interesting problem is only 10% of CP are because of birth asphyxia. So there are a lot of other problems, other causes which are operating from antenatal level and also after birth. So we have to consider the other factors rather than only focusing on the birth asphyxia or neonatal asphyxia. And these are the different types of CP. You know that hemiplegic, diplegic, and depending on the damage in the brain, the manifestations vary. I'm not going to the detail of that. So the common medical problems in cerebral palsy patients are basically neurological disorders. They have epilepsy, which is quite common, and movement disorders, and of course cognitive impairment. Musculoskeletal disorders, which is very common in most of the CP patients, including contracture, osteoarthritis, spasticity. Respiratory disorders like aspiration pneumonia, because they have sometimes swallowing problems, restrictive lung diseases. Mental health disorders like depression, aggression, isolation problems, and nutritional disorders. This is in one way because of the swallowing difficulties, less chewing capacity. So these are the different medical problems we encounter in a patient with CP. And so the risk when we treat a CP patient might be because of the medication we use for them, or might be because of the other measures we take to improve their health conditions. Now, the medications commonly used in CP patients are antiepileptics, antispasticity medications because they are very spastic, drugs for movement disorders because they have a variety of movement disorders, antipsychotics, antidepressants. So these are the common medications we use in case of CP patients other than supportive treatment. And the risk like physical therapy related risk, anesthetic procedure related risk, surgery related risk, which I'm not going to elaborate in this talk. So while treating a CP patient, we have to know how they are different from a same aged children or adult. They have variable levels of locomotor, cognitive, swallowing, visual, hearing, and coordination impairment. So whatever treatment we deliver to them, we have to take into consideration that the treatment itself should not cause into their day-to-day functioning. Because every neurological drugs, they have some kind of neurological problems when you attain a certain dosage level. So we have to be very careful about instituting the medications on them. And they also have an altered physiology related and unrelated to the cerebral palsy. sometimes they are on multiple drugs. So drug-drug interactions is very common in this kind of scenario. And most interestingly, when I was asked to talk about this subject and I went to look at the literature, I found, surprisingly, there are very limited data on particularly in this issue. Researches are going on in different other areas of CP, but these medication-related conditions and the problems, there are actually very limited data. So the antiepileptics, like common antiepileptics like phenytoin, which we normally use in many normal children as well as in CP, they cause incoordination, eye movement problems. Sometimes the bone becomes very weak, called osteomalacia, and they develop a fracture risk. So using this particular drug in CP patients, we have to be careful about all these factors. Phenobarbital, we do not use these days, but it has an addictive potential. It can cause cognitive impairment, and the CP patients may have a pre-existing cognitive impairment as well. Clonazepam has got an addictive potential. It can cause drowsiness. It can develop tolerance. Valproate should be avoided in many other reasons, including a weight gain, which is a problem in some CP patients. Chopidamate also can cause cognitive impairment, and carbamazepine, as we know, can cause significant drug allergy, drowsiness, and visual impairment. These are the few medications in the list where we have to be careful about the common side effects in this group of the children. And other drugs like antidepressants can cause dry mouth, weight gain, sometimes drug interactions with others. Antipsychotics are required sometimes, but may cause, again, drowsiness. And antispasticity medications like baclofen and tizanidine, again, sleepiness and drowsiness is a common problem with this type of children, and other drugs. So I'm not going into the detail of each and everything, but we have to look at the future. Now, the future is, these days, we are talking about pharmacogenomics. Pharmacogenomics is deliver a personalized precision medicine to a patient according to his genetic structure. It's not that we have reached a very far level to attain that kind of precision, but the research is underway, and we have, if you look at this picture, it's like on your left-hand side, you can see, suppose you buy a dress which fits to each and every patient, be the tall, small, or medium size. Like a drug, giving a standard dose to each and every person, it may not be effective because of the variation in the metabolism. So before giving the drug, if we know the metabolic parameter of the patient or the metabolic potential of the patient and tailor the medicine dose accordingly, then probably we can minimize the side effects of those particular medicines. And so there is an example on your left-hand side. This is a small gadget which can readily give you the diagnosis of two genes which are responsible for metabolism. This is just an example. It is already commercially viable and available. So you can see there are few genes are available which can give us an idea which patient is going to develop an allergy to a particular drug before you actually prescribe the drug. So this kind of development is going on, and maybe in future we can give a more tailor-made treatment to this group of children without facing the problem of complications, drug interactions, allergies, and other side effects. So we need research. We need research actively for antenatal diagnosis of the children with CP at risk by antenatal imaging, genetic diagnosis, or other biomarkers maybe. We need a rapid diagnosis of CP, because by the time we pick up a patient with CP when their motor development is underway, 1 year, 1.5 years, or 2 years sometimes, it is late. So if you can institute the treatment even earlier by giving some early diagnosis, so we can be a little bit ahead of time. And personalized and precision medicine for this group of the children is also very important. So again, the research is very important, and this group is already working on that. So we need more active research from different parts of the world. Thank Thank you for your time.
Thank you, Dr. Roy, for your very much informative lecture. Is there any question from the audience side?
So, what is your advice in that cases?
No, of course, if it is necessary, you have to give. But as I told that, since many of these children are on multiple drugs, depending on whether they need antiepileptic or not. So we have to use the minimum possible dose. We have to be careful about the drug interactions, whether they have sometimes the synergistic effect of drowsiness and sleepiness. So that is the thing we have to consider before we keep adding more drugs for these children.
Determination will be helpful for this, that particular gadget?
No, this gadget is just one example, because the Roche, this is a French company, they have already developed one of these gadgets. It's not that a single gene can give you the prediction for each and every drug, but this is one metabolic gene is already been identified and is readily available for different types of diseases. So I'm talking about the future. So in that future, if we have this kind of diagnostic potential for each and every drug, so that you can tailor-made and decide which drug is the best effective with the lowest possible dose.
I'm not a medical professional.
Yes.
I'm a parent. From my experience, I find that many of your researchers, they don't reach to the ground level doctors. And second point is that you are very shy of publishing it in popular newspapers and magazines of your research in a popular way, so that the parents and other affected persons, they can understand, or they can interact with the local doctors. So what is your opinion, or what steps you can take for this? Thank you.
Yeah, I agree with that, your second point, that this interaction is very important, because the society should know what is exactly going on. So I think this Bishwa Bandhan in this particular area on CP is one kind of forum where we can interact with the science and the society, so that we have a kind of interface. So I agree with your point that more and more interaction between these two groups is very important for the proper delivery of the science to the society.
Sir, most probably you cannot or you shouldn't publish all these things in the popular media, because there is every chance of misunderstanding, and
Correct.
it is much misunderstood by the general population. Most of this knowledge they should know from their general practitioners. That
is the idea. It should be go to the scientific journal.
Established therapeutics, once that has come out, that goes to every doctor and then goes to every patient. But when it is at a research level, things have to be done under certain protocols. And depending on that, and once research becomes treatment, then it goes to everybody.
I agree with you, but when till the research is going on, you cannot say like that. But when the research is over, or it has reached to some level, so that the doctors can use that as a practice, and then you can publish it in local or medical or popular journals and newspapers, so that people at large should know all these things. I used to write on cerebral palsy for mass awareness in various newspapers and journals since '92. So I find there is no problem in this, because people should know what is what. Unless they know, how they will react with when the doctor says what is saying, it is final. And if you want to interact with the doctors will simply say, oh, you don't know anything. So what I will say, we are facing this type of problem.
Everybody is
This
going
is a fact.
to the internet now and finding lots of information.
Everyone is not able to reach to the internet.
No,
You are talking about the urban people. Semi-urban and other people, they don't.
Can I respond?
Oh, sure.
Because it is not in the form of advertisement what he is talking about. But there is a special paper for special day, special pages are there in every newspaper. And it is coming regularly, particularly by monthly or by weekly, there is a special pages. And after long research, when it is established, it is coming. Yeah. Definitely it is coming, I'm telling you frankly. But it is not the coming, what he is talking about in the form of advertisement. May not be. But in the writing it is coming every day. I mean, you can go even in the vernacular, in the Bengali vernacular, in the English vernacular, it is coming. Of course, I am telling you, there are special pages for special day, particularly a week in the education, health, and so this type of pages is coming, and it is coming. I am telling you.
Thank you
So sure,
very much.
I am so sure.
Yes, thank you very much.